Hello and welcome. Today we're diving into a sensation that can literally turn your entire world upside down. We're going to demystify that disorienting and frankly often terrifying experience of vertigo. So let's get right into it.
So here's our roadmap. First, we're going to nail down what vertigo actually is. Then we'll get into the most common culprits, the ones hiding in your inner ear. After that, we'll talk about the more serious stuff, when the problem is actually in the brain. We'll put the two types head-to-head in a direct showdown, and then finally, we'll give you a peek inside a doctor's thought process so you can see how they connect the dots.
All right, section 1. Let's start at square one. What is actually happening inside your body when you get that intense room-spinning feeling?
It is such a strange and unsettling feeling, isn't it? You know you're standing still, but your brain is screaming that you're on a roller coaster. That powerful illusion of movement, that's the classic sign of vertigo. It's not just feeling a little dizzy or lightheaded. No, this is something way more specific and intense.
And this right here is the heart of the matter. You see, vertigo isn't really a disease itself. It's a symptom. It all boils down to a glitch in your vestibular system. Think of that system as your body's built-in gyroscope, located deep in your inner ear. It's constantly telling your brain which way is up. When that system sends faulty signals, your brain gets totally confused, and suddenly, the world starts to spin.
So this brings us to the most important question for any doctor trying to figure this out. Where is the glitch? Is it a problem with the hardware out in the inner ear? We call that peripheral vertigo. Or is it a problem with the main computer, the brain itself? That's what we call central vertigo. And believe me, figuring out which one it is, that changes everything.
Okay, so let's jump into that first category, which, by the way, accounts for the vast majority of cases. We're talking about the problems that start and end right there in the inner ear.
Now, if you've ever had vertigo, there is a very good chance this was the culprit. It's a real mouthful, I know. Benign paroxysmal positional vertigo, or just BPPV. But the name tells you a lot. Benign means it's not dangerous. Paroxysmal means it happens in sudden, short bursts. And positional means it's triggered by certain head movements. So what's actually going on with VPV? Well, deep inside your inner ear, you have these tiny little calcium crystals. Normally, they sit where they're supposed to, but sometimes a few of them break loose and start floating around in one of the inner ear canals where they don't belong. So when you move your head, like just rolling over in bed, these little rogue crystals tumble around, sending a massive false signal to your brain that you're spinning like crazy. The key things to remember are that the vertigo is super intense but really brief, usually less than a minute. And, this is critical, your hearing is totally fine.
And you know what the best part is? The fix is often surprisingly simple. It's not about pills or surgery. A doctor can perform something called the Epley maneuver. It's just a series of specific head movements that uses good old-fashioned gravity to guide those little crystals right back where they're supposed to be. It's just physics.
Okay, moving on to our next inner ear issue. This one feels very different from BPPV. It's called Ménière's disease, and the best way to think about this one is as a pressure problem.
Ménière's is famous for what doctors call its classic triad, these three symptoms. It's all caused by too much fluid building up in the inner ear, which creates extra pressure. This leads to episodes of vertigo that can last for minutes or even hours, not just seconds like BPPV. And here are the other two huge clues. It comes with hearing loss that can come and go, and tinnitus, which is that ringing sound in the ear.
Okay, last stop on our inner ear tour, we've got two conditions that are really similar, often caused by a virus, but they have one giant difference. First, there's vestibular neuritis. That's when just the balance nerve gets inflamed. You get this sudden, really bad vertigo that can last for days. But, and this is the key, your hearing is perfectly fine. Now, labyrinthitis is when the entire inner ear structure gets inflamed, both the balance parts and the hearing parts. So with this one, you get that awful vertigo plus hearing loss. That one little difference is everything for a diagnosis. All right, let's totally shift gears now. We've covered the common inner ear problems. Now we have to talk about the much less common but way more serious category, central vertigo. This is when the problem isn't in the ear at all, it's in the brain.
And anytime we start talking about the brain, we have to talk about red flags. These are the warning signs that tell you this isn't just a simple inner ear issue. This could be a real medical emergency.
Okay, this is so important. Vertigo that comes with any of these other symptoms is a huge red flag. We're talking about a sudden, severe headache, the worst headache of your life, or ataxia, which is just trouble walking or coordinating your movements, or really any other neurological problem like slurred speech or double vision.
One really specific sign a doctor looks for is vertical nystagmus. That's when the eyes are moving uncontrollably up and down instead of side to side. These signs point to very serious things, like a stroke or multiple sclerosis.
So now that we've looked at both sides of the coin, let's put them right next to each other. This is how you can really start to understand the difference between an inner ear problem and a brain problem.
So imagine this. You stumble into an emergency room. The whole world is spinning. How on earth does a doctor quickly figure out if this is a harmless ear issue or a dangerous brain issue? Well, it all comes down to looking for a few key patterns.
This table really lays it all out. Look at the difference. Peripheral vertigo, the inner ear kind, usually hits you suddenly and can be incredibly severe. It can literally knock you off your feet. But here's something that might surprise you. The more violent the vertigo, the less likely it is to be something dangerous like a stroke. Central vertigo is often much milder. And look down the list. Hearing loss, common with inner ear problems, but super rare with brain problems. The eye movements, usually horizontal with peripheral, but vertical with central. But the biggest clue of all is that last row. If it's only vertigo, it's almost certainly peripheral. If it's vertigo plus any other neurological sign, you have to think central.
Okay, for our last section, let's pull back the curtain a little bit. We're going to look at the simple but really clever process a doctor uses to figure out exactly what's causing your world to spin.
It really boils down to this elegant three-step approach. First, it's all about timing. Did the spinning last for just a few seconds? That screams BPPV. Was it minutes to hours? That points towards Ménière's. Did it go on for days? Now we're thinking neuritis. Step 2, the hearing question. Is there any hearing loss? If the answer is yes, we're on the track for Ménière's or Labyrinthitis. If it's no, it's more likely BPV or neuritis. And based on those answers, the doctor can then do a specific physical test, like that Dix-Hallpike test for BPPV, to seal the deal. It's a really smart and efficient way to narrow things down fast.
So, while the feeling of vertigo can be absolutely terrifying, hopefully you can see that understanding this basic split, inner ear versus brain, and knowing the key questions about timing and hearing, well, it gives you some power back. It helps turn a really scary experience into a puzzle that you now have some of the pieces to. And just knowing what to look for and what to tell your doctor, that is always the most important first step.